Well, welcome everyone, and thank you so much for joining our webinar today, From Inventory to Immunization, a Painless Way to Manage Vaccines. My name is Derek Torbeck, and I will be your host today. Next slide, please. And just a few housekeeping items before we get started. We do have a survey available to you at the end. Once you exit GoToWebinar, the survey will pop up, and in order to be entered for any of our giveaways today, we encourage you to complete that survey to be qualified. I want to encourage everyone to use the Q&A function within their GoTo instance to submit any questions at any time, because we will have a question and answer segment towards the end of the presentation. And finally, our next webinar is January 18th at 7 p.m. There's a link in the chat box to that, and I will be discussing a little bit more about that webinar at the end of this webinar. Next slide, please. And I think you could see our lovely speakers today, Brett Cleary and Susan Hannon. Brett Cleary has 20+ years of sales and marketing experience in the pediatric EHR space, and he's been a senior account executive with OP since 2016. And Susan Hannon, more than 10 years of experience at Office Practicum, prior experiencing working in a pediatric practice. So thank you so much, Brett and Susan, for speaking today. So what are you going to learn today? Well, we're going to show you how a comprehensive vaccine management and forecasting solution makes it easy to treat every patient visit as an opportunity to vaccinate according to patient-specific ACIP guidelines, stock the right vaccines to avoid tying up money in your fridge, and recall patients due or behind for vaccines to increase vaccination rates. And Brett, over to you.
All right. Hey, thanks, Derek. Appreciate you getting things started for us today. Welcome to all those that are attending the webinar today. We greatly appreciate your time. We look forward to discussing vaccine management with you. Just to alert you before we kind of get kicked off here, what you're looking at right now is part of our slide deck, but we're going to toggle between the slide deck and an instance of Office Practicum. So we think it's important to show you some of the important pieces of Office Practicum during this meeting as well. For those that are not familiar with, and by the way, sometimes we'll refer to Office Practicum as OP. You'll hear us use Office Practicum and OP interchangeably, but let me give you a quick snapshot about OP as a company. As you can see, we're all over the country. We're in 47 US states. That represents about over 1,300 practices. We have about 6,500 independent pediatricians using our software. And we work with about 20% of the independent pediatricians in the country. So we do have a pretty good share of the market. One of the things that you'll notice at the bottom is the client retention rate, and it says 97%. And we strive for perfection. We would love for that to be 98, 99%. And hopefully we'll get there one day. But that 97%, that's a really good number for our industry. And I think we can attribute to a couple different things. Number one, we have blinders on. We just focus on pediatrics. That helps a lot. Number two, we have a fantastic support team. If you can have good software, but if you don't have a good support team, that's not a very good recipe for your software itself. Along with the support team, we have great account managers. We have a customer advocacy team. All those folks really help keep our clients happy. And number three, we really do leverage our clients to help evolve the software. We're asking for ideas. They're providing ideas. We evaluate those ideas. Many times we implement those ideas. So I think those are a couple different things that are very helpful for our company. Moving on. If you guys recall, the HITECH Act of 2009, I can't believe it's been 13 years. It seemed, or is it 13? Yeah, no, 14 years. Long time ago. But as a result of that, we had the meaningful use stage 1 and stage 2. OP is both certified for both those meaningful use stages. But those were the building blocks for the latest certification, which is the Cures Act. So OP is ONC Cures certified. Being a pediatric specific vendor, we wanted to set the bar, especially being pediatric. So we were the first vendor to complete the Pediatric Health IT certification program. That happened last year as well. And then we are connected to care quality. And then really during the pandemic, we took a different approach to more of the whole child And that approach really was, again, a result of listening to our clients, saying, gosh, we're seeing a lot of kids with mental health issues, depression, things like that. And so what we did was reacted with adding some behavioral health care specific templates, but also we added a mental health monitor with clinically focused and actionable dashboards to help manage and monitor and treat the patients. The last thing I'll mention as far as informatics and really reporting is we do have a lot of great reports built into Office Practicum. Actual data is great when you can put them on reports and dashboards. So we do come with the clinical reports, the billing reports, but we also have a library of about 300 different reports that you can import into Office Practicum that will certainly help measure and track productivity, practice financials, quality measures, and certainly medical outcomes. Let's press on. All right, vaccine management. That's a good segue into this. So as far as the vaccine management, and you guys probably all know this, it's a very important piece of your business model, of your practice. And we know this for a couple different reasons. I'll go through these 4 reasons. Number 1, children are behind in routine vaccinations. We know this. We knew this before the pandemic. There was a study from the National Library of Medicine a few years ago. They did a survey for kids aged 24 to 35 months. Only 60% were fully vaccinated. But we know that gap has gotten wider over the years because we have the pandemic. So people not stopped, but a lot of the well visits were delayed. And other barriers like that. So we know for a lot of practices, there's a lot of work to be done to try to catch our kids up so they can get those routine vaccinations. Number 2, vaccines are the second highest cost to a practice after labor. Yeah, so if you're looking at your operating expense from almost all practices, you'll see that first line item. You're going to see, the salaries and the benefits and things like that for your employees. That's number 1. Number 2 is probably going to be vaccines. Now, there are some cases where a practice might be using VaxCare, a practice may be using, or maybe sees a lot of Medicaid, a lot of VFC, so it might not be applicable. But for a lot of practices, this is the second highest cost for the practice. So since vaccines are the second biggest expense, it really deserves a practice close attention. But the good news, you guys probably spend a lot of time investing in your employees and finding the right people. So your employees can be an asset for your practice, but vaccines can be a profit center if they're managed correctly. Number 3, identifying overdue vaccines should occur at every opportunity. It's one of those things, if you take anything away from this webinar as we go through this, I think the opportunity, I think it's huge. And the idea, and obviously Susan in a few minutes is going to show you how we look for opportunity as an OP. But one thing you may want to ask yourself, does your current system that you're using, does it give you good visibility? Does that front desk have visibility if the child is up to date on their vaccines? Triage, most likely your clinical team does, but is it visible at almost every part of the chart? So having the opportunities and making sure all the folks in your practice can make sure the kids are updated on vaccines, that's powerful. Number 3, know the value of the money that you have tied up in your fridge. Again, one of the things that I always ask the practice, I work with practices every day, and when I start working with these practices, I ask probably this is one of the questions that I always ask. I always ask, do you have any idea how many dollars are tied up in your fridge right now? And again, not to be redundant, but again, you've got the VaxCare and some VFCs that for some practices, and I'll be honest with you, so a lot of practices are getting better now, and they're getting better because I think during the pandemic, a lot of people are looking at their operating costs and they're paying a little more attention. But I still have a lot of groups that'll say, yeah, I kind of have an idea, and then I also have some groups that say, I have no idea. It's like they come to the confession booth. But really the key, it's really a 1-2 punch. You need a system that, number 1, knows the value in the fridge. And then number 2, you have a system that you can forecast what you'll need in the future. So, and it's a tricky balance because you don't want to over order vaccines because that can result in a financial loss to the practice. But if you under order and you have to tell a parent they need to come back, next week, that's not going to sit well with the parents. So it is a tricky balance. Let's go to the next slide, please. Vaccine management life cycle. So this is, each point of contact is an opportunity. I mean, if you're starting with vaccine inventory, you're looking what you have in the fridge, and you can look over that vaccine needs. That could be your forecast, and you see, okay, well, what do we have? What are we going to need? Things like that. Your practice at every opportunity is making sure that kid's up to date on their vaccine. You give the vaccination, automatically reports to your immunization registry. And then, obviously you want to, obviously for at least an OP, what happens is once that provider or that nurse administers that vaccine, you're getting those vaccine itself, the vaccine admin codes, you're getting those over to your billers, including, for at least OP, as far as your NDC numbers are included as well. So your biller can review that and get that claim remitted timely. And it's one big life cycle management. But again, I think, if you guys can take the every visit as an opportunity approach, I think that'll go a long way with making this a very profitable experience for your practice. Next slide, please.
Well, thank you so much for that, Brett. It looks like it brings us to our first polling question. So, audience, this is on you. We would love for you to vote. So our first polling question is, what percentage of your pediatric patients are behind on vaccines? And we want you to select one of the choices here. Is it 0 to 33%, 34 to 66%, 67 to 100%, or hey, maybe you're not sure? So please, the voting is open now. Please vote. Pretty interesting question, right, Brett?
Yeah, I'd say so. And one thing I was going to mention this before was, and some of the practices may already be doing this, but if you're not sure how much vaccine should be costing you or whether you're getting the best deal, the best way to track is to subscribe to, it's the CDC's private sector cost email service. Every time a manufacturer increases their cost, you'll get an email alerting you of the update. It's a simple Google search. If you Google current CD vaccine price list, you should be able to find it and then actually register for that.
Wonderful. We'll give you a few more seconds, and it looks like OP team is pulling up the results. Thank you so much, audience, for voting. Wow, we've got a good split here. So percentage-wise, 0 to 33% has shined through at 47% of the almost half of the people attending today have voted for that. And then a split between, hey, I'm not really sure, and about 34 to 66%. What are your ideas around what you see there on screen, Susan and/or Brett?
Yeah, I appreciate the honesty. I'm not sure, the 24%. Yeah, I mean, I think for the 0 to 33%, I think that's great. I think for the remaining percentages, I think it's about visibility. I think you can improve, seeing how your patients, getting them up to the current measurements, if you will, if you have more visibility. So I think if you have that in your system, I think that'll certainly help increase these numbers.
Yeah, well said, Brett. Thank you. And now, audience, we're actually going to go to Susan Hannon, who is going to go into the Office Practicum instance. Susan, take it away.
Wonderful. Well, thank you, everyone. And thank you for joining us. So just kind of briefly, I have this wonderful job at OP where I get to work with prospects and really showcase our system, but I also get to work with our customers to work with them to make sure that we can optimize their workflow, right? Successful practices make all of us happy, particularly with respect to how the healthcare industry has been over the last, couple of years. So what I thought I would do is show you the things that help a practice. You can think about, are these visible in your system? Are there ways to make them visible? Or let us know if we can help you in any way. So the first place we really want to look at, and we think about each of those opportunities where we speak with a mom or we speak with a patient, are we looking at vaccines as a specific item? So when I open up my appointment, which is my Add Edit appointment screen, so it's my check-in, it's my checkout, no matter what I'm doing, it automatically will, and so I just want to ensure you folks can see my screen.
I know.
All right, so let's see, sorry about that.
There you go.
All right, sorry about that, everyone. So from here, we're going to just look at our appointment screen. So from the very first touch point, whether I'm in an office where my front desk makes appointments, whether I have a scheduling office, I absolutely can look at my vaccine forecast. So that ACIP schedule, that CDC schedule that we all adhere to, we actually put that right here as step one. So it allows my front desk to answer the question to the mom, sure, it looks like your kiddo is due for these. We know our front desk gets asked that question all the time. They don't have to go hunting into the kiddo's chart. But it also is a great opportunity to introduce the topic of a vaccine. The kiddo's coming in for, you know, a non-sick visit, the poison ivy, the bumps, the bruises. Hey, mom, it looks like they're overdue for a flu shot. They're due for their second HPV, their second Menactra. Maybe we can get that done at this visit, and then, you know, save you a visit to the office. So really think about vaccines as a key component of, again, every visit. So the second place we do it is messaging. So again, this could be your front desk. This could be a message center, your triage nurses. So I'm in a message here. And so no matter what message I have, I can see information from my patient chart. So the first thing is my kiddo here is overdue for a well visit. Well, that's critical, right? So it's not just the vaccine. We know that our kids are also behind on those well visits where we administer the vaccine. So those developmental milestones, the rest of the medical care we need, always knowing when they're due, particularly for those little ones who have that pediatric schedule. The second thing is the ability to look at that same immunization forecast. So, you know, the ability to look at it at any given moment. Now the mom's calling, looking for information. Gee, mom, it looks like your kiddo is due for a well visit and has some vaccines. Let's see if we can get that scheduled, right? It's that moment we get that mom on the phone. The patient chart. So obviously a key piece. So just so you can see what when that forecast, where it's actually coming from, and again, a vaccine logic, the ability to forecast not just on a visit. So it's not just saying at this visit we give, but it's actually looking at the individual child's actual immunization record and then forecasting the immunizations that they are due for based on that CDC or ACIP schedule. And so we know kids are behind, so those catch-up schedules, having those automated, we're not having to calculate, you know, live vaccine intervals or any of those other things. A vaccine system, a vaccine logic that will do it for you is a critical item. And then the last place is actually within the visit itself. So on my order screen, my provider can see my overdue vaccines here at the very bottom. I, by the way, can click. So if I'm a provider who likes to see it in full time with the full schedule, absolutely. But the ability to know what kiddos are due for so that you can order appropriately. And then right here, just as a teaser, we're going to look at inventory in a moment, but for the provider to be able to see exactly what is in their fridge at real time based on the private stock as well as the VFC status. So that's it. And back over to you.
Yeah, thanks, Susan. Yeah, as Susan mentioned, it's a team effort, right? So front desk, appointment scheduling, your clinical team, your nurses, MAs, looking at the forecasts, and certainly with a provider, certainly being able, once they're looking at whether it's the chart or once they're about to order a vaccine, all those eyes can be set on a patient's chart to make sure that they're staying up to date with their vaccines. And then just to highlight some of what Susan had mentioned, which is important. Again, Susan mentioned with that on the left-hand side where that arrow is, being able for your front desk to have that information that, yeah, the child is overdue for a vaccine. it could be a flu shot, right? So, when they've got them on the phone, hey, mom, oh, by the way, just want to alert you, we have a flu clinic next week. Can we get you on the schedule for that? Those are good proactive movements. Same thing with the vaccine forecast, as Susan mentioned. Once that telephone triage team takes that call, again, trying to be proactive, making sure they're up to date on the vaccines. That's incredibly important as well. And then if you go to the next one, thank you. Again, going back with our clinical and provider roles, as you can see on the left-hand screen, whether you're the nurse, whether you're the physician, nurse practitioner, you're going to have complete visibility practically anywhere in the chart to be able to actually look at that immunization forecast and what they're due for. And what's great about the screen on the right is, like Susan said, you're able to identify which vaccines are behind, which ones they're due for. We don't have it illustrated in this particular screenshot, but we do have one. It's highlighted in pink, so it'll let you know if that vaccine violates a minimum spacing or age rule as well. So we'll keep you notified on that as well. There's a little sync registry button up there too. So for many of our states, we do offer bi-directional interface. That's helpful too, especially if you've got those new kids that are coming in the community and you want to get their vaccines into your chart as structured data.
Well, thanks so much, Brett and Susan. That was a really great segment, and that will segue into our next polling question. So, audience, it's up to you once again. What is the most difficult part of managing your vaccine inventory? And we have some options here for you. Ordering based on patient population need, minimizing the amount of money I have tied up in my fridge, minimizing vaccine waste, or all of the above. So please vote now. Voting is open. And Brett, I can imagine we see a lot of difficulty here, right?
Yes, we do. I will make mention though, as far as the folks on the meeting, you may want to check with your vendor to see if they have that barcode scanning. That's very helpful, particularly when the person that's responsible for putting in those vaccines, if they can do it with maybe, for example, OP has 2D barcode scanning, the benefit gained is time. But really what happens is, instead of them having to kind of key in manually all those vaccines, when they get all that vaccine shipped to them, using that barcode scanner will just expedite that process a lot faster.
All right. So it looks like we should be having some results coming in. Ooh, a really good mix here. Probably to be expected, but we see pretty equal mix across the board. Obviously, minimizing the amount of money I've tied up in my fridge leads here, but obviously not far behind is a little bit of everything here. What are your thoughts, Brett and or Susan, on what you see on screen here with the results?
Well, I don't want to steal Susan's thunder because she's about to show you how you can minimize that tying up on the fridge. But no, I think what's interesting about that, it's across all the boards. So yeah, I will let Susan address that here in 1 second.
Well, thank you, Brett, and that's exactly what we're going to do. We are going to go to Susan to go back into the Office Practicum instance. So Susan, take it away.
Okay, wonderful. So Brett, you can see my screen?
I can see it perfectly, thank you.
All right, perfect. So really what we want to think about here is a couple things. So one thing to the folks that put in, it's the waste, right? We know that there's waste. A lot of time it's because we draw up a vaccine that we think we need, and then it's when we realize, oh, they're not really due. They're in a catch-up schedule. So we normally give something at a certain age, but we can't because we're not at a minimum interval kind of thing. So really that forecast that we were looking at previously really goes to helping eliminate the waste. It also can help because the vaccine that is shown or presented to our nurses is really based on the kiddo's VFC status. So it helps where we draw a private, but the kiddo's is a VFC or a VFC and the kiddo's private. We don't end up with that waste. We know a lot of states don't allow the borrow and payback, some do. But those are also really important ways for helping with that waste. What I'm looking here at is my vaccine inventory itself, and you're going to see I have a lot of money tied up in my demo site here. But when I look at my vaccine inventory, a few things are really important. Can you do your inventory by location? So truly a great thing for our practices that are location specific. And when a provider orders a vaccine, he's only looking at the vaccines in the fridge in the location that he's in. But for those that do central ordering, you can actually bring all of your locations in so that you can see what's available in all of them. And I'm looking at my Happy Kids pediatric location. Right here at the bottom, I can see I have $101,000 tied up in my fridge. If I'm an enterprise practice, it's a lot, but not tons. But for smaller practices, that would be a lot of money. Doesn't really matter the size of your practice, making sure that the inventory is accurate to your practice's needs and not really what the pharma rep thinks you need is really a critical item. As we saw, our vaccines are separated by VFC or private. For those states out there, I know of 3 or 4 that give what we use the term universal vaccines, where vaccines like Washington State, all vaccines are provided by the states for all kiddos, regardless of their insurance status. We actually, I have a couple in here as well. Absolutely, we can do an inventory for that as well. This lets me count, manage, order, report. So any of those VFC reports we need when our auditor comes in, we actually have all that information as well. Now, when we look at, I'm just going to close up my inventory here. When we really think about ordering, we don't want to order just what's based in my fridge alone, right? We want to look at what is the need within my practice. And again, thinking about at what ages do we traditionally administer vaccines? So looking at my Daptocel here, in my practice, I give my Daptocel at 2, 4, 6, 18, and 48 months. This is absolutely going to be something that you could put in, but I'm going to say I'm pretty good about getting our moms of our little ones to take the Daptocel. So I have about 100% probability of getting those in. Right now on hand, my private stock versus my VFC, I'm going to focus here on my private. I have 404 vaccines, Daptocel vaccines in my fridge. And in February, I'm going to have 26 kiddos that are those ages. In March, I'm going to have 21. And in April, I'm going to have 24. So I over purchased for my Daptocel. And that's really what we're looking at. The forecast is really looking at those ages and the uptake, the ability to get those shots in arms. So when we think about vaccines, and I'm just looking at my HPVs here are the ages that I give this vaccine. But my parents aren't as good about saying yes at those ages. So I really want to forecast this at 60% of my kiddos. So 20, that would be 23 kiddos in February, 22 and 21. So it actually takes into account that differentiator of really how good am I about getting them in. A lot of it is parents don't always bring our bigger kids into the office unless they need those sports physicals or whatever. So here is a way to look at that forecast so that when your farmer rep comes in and says, hey, wouldn't it be great if you purchased this big amount, it's easy to be able to come in and see.
Yeah, so just to recap, thanks, Susan. Yeah, if you're looking on the left-hand side, like I said, the vaccine inventory, what's great about that, actually at the bottom arrow, and I know that it might be a little smaller on your end as far as looking at these numbers, but yeah, looking at $90,900 sitting back in there in the fridge right now. If you look at that blue line, again, like I said, it's a little tiny for you guys to look, but those vaccines, the 3 above it, those have all expired, unfortunately. So in this scenario, this practice lost about $6,000 or $7,000 worth of vaccines. So we can certainly be more proactive if we get to that point using the vaccine inventory system. As Susan had mentioned, obviously being able to toggle if you're just a single location practice, obviously you won't have to do anything. But for those practices that have multiple locations, being able to go from different locations is certainly helpful. And then again, if you just want to look at everything, one big lump sum, you can certainly do that. Yeah, Susan hit the nail on the head on the right-hand side as far as doing those vaccine forecasting. You're probably this is probably gonna be a farmer rep's worst nightmare when you come over here and you're like HPVs, like, no, I'm only gonna use about 70 in the next 90 days. I've got 209 in hand. So I think it does do a very good job on the whole just-in-time ordering aspect of things, and allowing you guys to order those vaccines when you need them. Moving on. And again, like we're talking about, just to reiterate, being able to track in real time, location specific, central ordering, it's very helpful. Track VFC inventory separate from private stock. We give you the ability to separate those two. And then inventory automatically adjusting as vaccine are administered is documented. Susan may have mentioned this, she's mentioned in the past, but really the vaccine is like a grocery store, which is very helpful. So, if you're a provider or your providers are in there about to order a DTaP for a child, they're gonna say exactly, I've got 10 doses left. So that provider that comes right behind them, him or her, again, they're gonna see now it's down to 9. So being able to order with confidence, I think, is very helpful when you have a good vaccine inventory system.
Thanks again, Brett and Susan. And we go to our final polling question. And I just want to mention to the audience, please, if you have any questions, we will be having a segment coming up shortly. So if you have any questions at all, please submit those in the Q&A area. So next and final poll is, are you able to easily identify any due or overdue vaccines based on ACIP or CDC schedule for a patient at any visit? It's a yes or no question, and we'll give you some time to answer. Brett, any feedback on this kind of question that we're asking the audience?
Yeah, maybe a little different though, because I wanted to mention something, because I made the point of talking about sync registry and bi-directional interfaces with your state and local vaccine registry. Yeah, it's one of the things that we pride ourselves in doing. We have over 40 state and local vaccine registry interfaces, and a lot of those are bi-directional, which are very helpful. Being able to go and import that data for kids that have moved into your community. But yeah, so you may want to check with your vendor, I should say. See if they have that bi-directional if they don't already, and obviously being able to try to report that in real time. That helps, especially when you're trying to quickly get a child with their immunization certificate and things like that, instead of having to go directly into the state website. Just being able to have that embedded into OP, I think that's helpful for some of those forms as well.
Yeah, that's well said, Brian. Looks like OP team is pulling up some results for us on this one. Wow, very close here. Yeah, 57% yes, 43% no. Brett and or Susan, any comment to that split?
Yeah, I guess more for the no folks. Yeah, again, I think it's all about opportunity and visibility, and certainly I think pressing your current vendor to see if they can make things more visible from the front desk to the triage to maybe a little more visible for the providers. I think that'll help as far as being able to identify some of those vaccines that are overdue.
Yeah, well, thank you, audience, for participating in those. That was very helpful for us. And now we will throw it back to Susan Hannon for another look into our office practicum instance. Susan, take it away.
I can see you just fine, Susan.
All right. So when we think about our population of kids, one of the things that we think is really important is getting them back in the door, right? So yes, vaccines, and that's a critical component. But one of the things that we also know is that kids are really far behind on their well visits, which is really about the good medicine piece of this. So you really want to think about your data as data that you can use for informational purposes, but really for useful, whether it's medical, whether it's for your billing team. So all I did is we have a reporting tool called the demographics analysis and recall. And so from here, I can bring all of my kids in my practice into one report. And so if I have quality initiatives that are based on a specific payer, I'm going to be able to do this payer specific. But right now, I'm just going to look at my little ones just to make this easier within our webinar today. So first thing I want to do is I want to get my kids through the door, right? I want to get them caught up. I want to make sure that I'm doing my developmental milestones. I want to make sure that my surveys, my MChats, all of those things are being done, or my PHQ2s and 9s, or whatever those things are that we need to do at the age specific, that periodicity table. So OP has the periodicity table built in to our system as a care plan. And it means that we can recall kids on any items. And at this point, really what I'm focused on are those well visits. And so when I recall my kiddos, the first thing is that, again, when we think about our pediatric schedule, not all of our kiddos come in at 12-month intervals, right? Adults, like all of us, go once a year. Our kiddos come in at the 1 month, 2 month, 4 month, 6 month, all the way up to those 3-year-olds. And from there, we move to an annual visit. So from here, my intervals, you can see, are 3 months and 6 months. And some of my bigger kiddos down here have moved to that 12-month interval. But now from here, getting messages out to mom, you know, your kiddo is due for a well visit, please call and schedule, please self-schedule, right? Getting kids back in the door and getting them into that regular visit sequence that we need is critical. And I think that's step one. And of course, part of that, particularly again for our little ones, are those immunizations. The second part is when we think about immunizations themselves. And so we know a lot of folks are participate in different quality initiatives. I'm going to do my polio here. It could be for any reason we want to recall. So for our providers, we know that it's important to get our kids in for vaccine for good medicine. But when I put on my business hat, I know that getting my kids through the door it's really also good business. It means that I'm using that vaccine inventory that's in my fridge so I don't have waste. It means that I can go through those quality initiatives, right? So my numerators, my denominators, how many kiddos of 11-year-olds do I have, and how many have that first or second HPV, right? Being able to do that quality reporting, which is critical in any system, truly easy in a system like OP that has structured data. But the other scenario is something that comes up, frankly, almost every year, even notwithstanding our public health emergency with COVID. It's whether it was measles epidemics, whether it's polio, which was the big epidemic we saw in New York State this year. The ability to then look at our kiddos, we need those kids through the door. We need to protect them. So the ability to recall your kiddos on a specific vaccine, and again, being able to send that blast message out, your kiddo's due for polio, please get an appointment and let's get that kiddo through the door. So critical elements, well visits where we administer those vaccines for reasons that could be quality initiatives or for good health. No matter what hat we're wearing, I think all of those are critical parts of ensuring our kids are well taken care of, but also our business is thriving.
Thank you, Susan. Yeah, when are vaccine recalls important for our practice? And as Susan mentioned, bolstering an immunization drive during a disease outbreak. Yeah, it was a fantastic example. It was actually September of 2022. There was polio virus detected in water samples in several New York counties. So our clients were able to then, again, there's really two parts of the equation. They were able to find the kids that were overdue for that specific vaccine, that polio vaccine, number one, and then two, message them out to let those parents know that this is something they need to pay attention to and hopefully get their kids to get caught up on that particular vaccine. So the other one is practicing high quality care and protecting the community. Yeah, Susan mentioned this correctly. It's two different hats, right? You know, obviously you're trying to provide the best quality of care for your kiddos, but you're also, you're trying to, your business, so you're trying to make money as well. But one of the nice things about OP was you can certainly identify a segment of the patient population by age and gender. So it might be a good example, might be, maybe our female patients, ages 11 to 17, we want those kids that are overdue for an HPV to come in to protect them. So you're able to do that within the system. And then practices looking for vaccines to be used prior to an expiration date. We went over that. Again, when you're looking at your vaccine inventory and you're noticing that you have just a lot more vaccine that's really needed, being able to go to do that recall to find those patients and then message them to let them know that they're overdue for a vaccine. I think that's important as well. And obviously something a lot of the people on this call experienced during the pandemic. If you're in a situation where sick visits decrease, a practice can be very proactive and use the vaccine as well as the care plan recalls to help increase those patient volumes. Again, right after that vaccine, for those first several months, a lot of the practices that, sick visits were down, a good 40%. And so what practices, a lot of the OP practices, what they did was they reacted by using the care plans for both vaccine and the care plans for like overdue well visits and ADHD follow-ups and things like that, and reach out to their parents to let them know that they're overdue for this visit, trying to increase more volume into the practice. So different ways you can certainly use the recalls to help your practice with quality of care as well, and revenue purposes.
Well, thank you so much, Brett and Susan. That was a really wonderful segment. And now we want to get to a couple of questions from our audience. OP team, do we have some questions that we can have Susan and or Brett answer?
Yeah, thank you, Derek. And thanks everybody for submitting your questions. Let's jump into the first one here. So we have someone asking, how well does VaxCare integrate with OP?
Yeah, we have a lot of practices that actually, first of all, we do have a working interface, number one. It does work well. The nice thing about the VaxCare interface is it doesn't disrupt what's going on in your practice. So, and what I mean by that is if you still need to do a recall because you still want to find those kids against a poliovirus, regardless of the VaxCare interface, we're still going to be able to find those kids. You're still going to be able to look at the vaccine forecasting and the vaccine inventory, but it is a very popular interface amongst our clients.
Awesome, thank you. Next one we've got here. How often are practices usually conducting an inventory of their vaccines?
Well, best practices, you should really do it once a week. So a lot of practices never do it. We have folks that do it once a month. The benefit of matching what is in your fridge to your inventory, however you're maintaining that paper inventory or computer inventory or that spreadsheet, is that it ensures that your kiddos' records are accurate and up to date, which goes to things like school forms, but it also ensures that you're getting paid for something you did, right? So if you administer a really expensive vaccine to a kiddo, all vaccines have costs, but some of our vaccines are $200, $250. Imagine if you administer that vaccine and you don't know it, right, from with respect to that billing, you've actually lost a lot of money. So it's not even a profit center, it's actually a loss. So best practices for us, and it just makes it easier, it's not as many. If you do it once a week, that's our best practices recommendation.
Great, thanks, Susan. Next one we've got here. Does the barcode reader also scan individual vials to document the vaccine?
Yes.
Awesome, easy one. All right. Let's see. Okay, so it looks like someone said we are currently doing all of our immunization registry reporting by hand, and it's taking us a very long time. Are you connected to the Virginia State Registry?
We are. We're connected to, as Brett mentioned, over 49 state and local. For those who don't know, some of our cities have their own. They don't want to participate in some of the state ones. So we are connected to over 49 of them. We also allow practices to connect to more than one. So if you have 2 locations, doesn't matter what the size of your practice, you have somebody in New York and New Jersey, you can connect to both immunization registries. So a lot of folks have one, but their other location they have to do by hand. We actually can connect to multi registries at the same time.
Perfect, thank you. And it looks like we might have time for one more. What do practices usually do when parents refuse vaccinations?
As a former trainer, Susan, you've got that.
The AAP recommends highly that you do that documentation of the refusal and get a signature, right? Our system can do the refusal, most I think can, but you really do want to get that documentation done. And again, AAP recommendations, I believe For anyone that's a member of the American Academy of Pediatrics, they have a form that they actually even recommend if you want to get the paper signature that you can get from them. But truly important to get that parent to document the refusal.
Great, thanks, Susan. Derek?
Well, thank you so much for that segment as well. The questions very well asked. And I want to thank everyone for attending today. It really was a pleasure for us to have you. And we encourage you again, once you exit out of your go-to instance, a survey will pop up. And please complete that survey so you can be entered into our prize giveaway. And as I said earlier, join us for our next webinar. We're going to keep going. Tips to reduce your EHR documentation burden, which will happen on January 18th at 7 p.m. Eastern Standard Time. On behalf of Brett, Susan, and the entire Office Practicum team, I want to thank you all for attending today, and I hope you have an amazing rest of your day and week.
Thank you.
Thank you, everyone.